Alrighty, thank you, Mark. Looks like a good time out there. And tonight in Medical Rounds, it is back to school time, and that also means sports activities are starting to kick into high gear. But before your child takes to the field or the ice, you should keep in mind potential injuries, especially concussions. And joining us live now to talk more about this is Dr. Seetharama, the medical director of the Hartford Hospital Rehabilitation Network, with some important information and advice for all of us parents of athletes. Good evening, doctor. Thank you so much for being with us.
Good evening.
You know, we hear the word concussion a lot, but just tell us, first of all, what exactly is a concussion?
So it is a direct blow to the head or an indirect hit to the face, jaw, or neck, causing the brain to be jostled inside the skull cavity.
And what causes a concussion?
So when that happens, that causes cellular degeneration inside the brain, neurotransmission defects, and that translates to symptoms like physical symptoms like headaches, dizziness, vertigo, balance problems, cognitive issues like confusion, short-term memory loss, sleep dysfunction, and psychological symptoms like depression and anxiety.
So some serious symptoms, but I think sometimes you're wondering as a mom or a dad, how do I know? So when should we be taking a child out of the game to see if he or she has a concussion?
So this is a very important question, and we stress this in our clinics all the time to the parents and the child, that when you see a hit that is suspicious of a concussion or a head hit, we ask that the child be immediately taken off the field and evaluated. There is more data coming out saying that if there is a delay in removing the child from the field, there's going to be a delayed recovery for that child.
And if we take them off the field, do we go right to the ER, or do we sometimes just let them sit and check them out on our own a little bit?
Well, here the sideline tests are not very clunky. All our schools that Hartford Hospital has contracts with, we have certified trainers on the sidelines, and they have a way of triaging and evaluating these patients. If it's a concussion, we take them off the field. We reevaluate them in our clinic. We see them within 3 days after an injury to evaluate how they're doing. And as you know, most kids recover in 7 to 10 days.
Which is great to know. Tell us a little bit more about your concussion clinic and what's offered there.
So it's a comprehensive interdisciplinary clinic. I work with the trainers. We test them physically, neurocognitively, and psychologically. The new things we are doing now is the Buffalo treadmill test, which is a way of directing how much the kid can do after a concussion without provoking symptoms. Our goal is return to learn more than return to play. We work with the schools and coaches to educate kids and educate the parents, and we work on prevention.
Okay, thank you so much, Dr. Seetharama, for sharing such important information for parents and the children as we head back to sports this year. Thank you so much. And if you would like to learn more, you can call 1-855-HHC here. In the meantime, Dr. Seetharama will actually be answering your questions. I'm sure you may have a lot of them right on the Hartford Hospital Facebook page. We invite you to join this live discussion that is happening right now.